Hey, good afternoon, everybody. Good to see you. It's been a long time. I wanted to take some time today to talk to you about the events that occurred in Montgomery County's Commissioner's Court and declaring a public health emergency in Montgomery County, and talk about what's going on with COVID-19 and try to give you some facts and information that is helpful to you and hopefully can calm maybe some of the anxieties that are going on out there, because I know people have them. And we really need to try to mitigate them, because we certainly don't want people to panic. I don't want people to panic. There's no reason to panic. We're not in a situation to panic. What we're trying to do is take mitigation efforts to reduce the number of spreads that occur with the COVID-19 virus and keep the curve low. It's reduce the curve, and I'll talk about that a little bit later. So I just want to talk to you about that. And I think it's a good platform to do that, and I hope that when you see this, you'll share it around. I apologize, it might be a little lengthy, maybe 10 minutes, hopefully a little less, but just to give you some good information and pass it around so that people can hear it and hopefully get some ideas of why things are happening the way they are when they may not understand or think it's silly that things are happening like this. A lot of events are being canceled, a lot of sporting events are being canceled, a lot of, the Montgomery County fair and rodeo is canceled, and of course the Houston Livestock Show and rodeo was canceled earlier this week. So I think it's important that this information gets put out, and I know there's a lot of sources putting information out, but I just want to make sure you get some too from me, and I think it's important. But before I start that, I do want to address one thing that happened at the Commissioner's Court today, and I'm going to direct this directly at my opponent, in that this is no time for partisan jabs at our neighbors about how they're handling the issue of this public health emergency. We all need to work together to get this done and make sure we do it in the right way and try to be as the least disruptive we can be to people's lives, even though we're completely cognizant of the fact that actions like what we're taking today in Montgomery County's Commissioner's Court are disruptive to people's everyday lives. And so they get that. These decisions aren't taken lightly. There's a lot of thought that goes into these decisions. There's a lot of discussions that go into these decisions because there's a lot of impacts of these decisions. And so I think it's important that people understand that. And I certainly, from a personal perspective, I really agreed with the actions today of the Commissioner's Court. I think it was the right action, and I'll talk a little bit about why that is later. The first thing I want to start off with was something you've been hearing over and over again. It's just some basic practices, safety practices, mitigation practices for you to do. And this is not an immunization from getting sick. This is just how you can try to protect yourself to reduce the likelihood that you're going to get sick. And again, it's wash those hands with warm soap and water. And do it for at least 20 seconds. I've heard people say, hum happy birthday twice before you stop. Whatever way you want to do it, count to 20. It doesn't matter to me. Just wash those hands. I'm a chronic hand washer no matter what, so at least I have a good practice right now. But yeah, definitely wash those hands. If you don't have soap, then you can use obviously hand sanitizer. But just make sure that hand sanitizer has at least 60% alcohol in it so it can kill all those germs. Avoid close quarters with other people that are sick. It's a common practice. We don't typically hang around with people that are sick on a regular basis, and this is no time to change that. So you just have to be cognizant of that and not hang around with people that are sick. And if you're sick or you feel sick and you have symptoms and you think something like the COVID-19, you might have it, then call your doctor. And I always encourage calling your doctor first. Have a conversation with your doctor's office about your symptoms and let them tell you how to proceed. It's one of the safest ways to do it because one of the practices of putting in place something like the emergency declaration for public health is we're trying to reduce the number of people that feel sick and aren't quite sure they are sick, but then just run to the emergency room and overwhelm the hospital staff or even your doctor's office, and quite frankly, maybe you spread it to other people that are there when we can try to mitigate some of those things. So always pick up that phone and call, and then you'll get direction from your doctor's office about how to proceed. And I think that's really important that you do that. And of course, cover your mouth when you sneeze or cough, and disinfect those surfaces that are touched all the time on a daily basis, and make sure you clean those surfaces every day with a household disinfectant, whatever it is. To make sure they're clean. And again, like I said, this is not going to prevent you from getting sick, because the bottom line is people are going to get sick. and they're going to get the COVID-19 virus. It's just going to happen. And in most circumstances, majority of circumstances, you're going to be sick for 10 or 12 days, and then you're going to be fine, and you're going to fully recover. And it'll be like having a really, really bad case of the flu. That's what it probably will feel like. It's a little different. You can, have seen all the different symptoms, how to differentiate between the cold and the flu and the COVID-19. But just understand that most people recover. And so it's not the end of the world if you get sick. It's just you have to take these actions to protect yourself and your family members. Because what we're really trying to do is protect those high-risk communities. And those high-risk communities are the elderly, the older population, 65 and older, especially the elderly population that have some pre-existing conditions, whether it be heart disease, diabetes, or some kind of respiratory or lung disease. These are things that put you at greater risk. And quite frankly, any age group that has some of those pre-existing conditions, it puts you at a higher risk if you were to actually get the virus. And the whole idea behind these mitigation actions are to try to reduce the spread, reduce the total number of people that get infected, and make sure we're trying to really protect those at-risk groups, because that's where the mortality rate for the COVID-19 comes into play. And I think it's important for people to understand that. And I also think it's important for people to understand that, testing, I know that testing is not available readily for everybody who just wants to get tested. You have to meet certain criteria from the CDC. If you want to go look at more information, go to cdc.gov. But it's important to understand that we are behind the curve when it comes to testing and how many tests have occurred. And I think it's important for people to know that too. But at this point in time, I think it's more important that we try to do mitigation efforts to reduce the number of people overall that get infected. Because it's going to happen. It's not that it's not going to happen. It will happen. It may not seem like it right now. We have a very low number of cases in Montgomery County, known cases, I should say it that way, which is 3 as of right now. And those are presumptive cases, which just means they've tested positive locally, and the CDC has not confirmed those test results. But the bottom line is they tested positive locally, and that's what that terminology means. And so what we want you to do, and so the next thing I want to talk about is the mitigation factors. And I'm going to show you this chart. I'm sure you've seen this chart. And I know it's probably backwards on this screen, the words, but that's okay. Don't worry about the words. Just look at the chart. And this is called reducing the curve and flatten the curve. That's what we're trying to do. And so you see when we take no mitigating actions for something like the COVID-19 that spreads the way it does, we could get to this orange-looking curve with the peak infections there at the top. And when we take some mitigating actions, like what this declaration does, and eliminating the number of events that have a large crowds at them, and shutting down certain activities that go on, that's why sporting events and those types of things are being canceled, and that's what we're seeing, because we're trying to make this blue curve what we see, where the peak is much lower. And there's many reasons for that, and that's the reason that these actions are being taken, so that number one, we can alleviate some of the stress on the healthcare community, because, we don't want to overwhelm the healthcare community, because not only are people going to get sick with COVID-19, there's also people that are going to have heart attacks or a stroke or a broken arm or those types of things, and those people are going to need medical attention as well. And we want to make sure that the medical staff is able to take care of everybody that comes in with some condition. And so those are the reasons that these actions are being taken. I know some people may think it's silly that these actions are being taken when we have so few cases, but the reality of it is the best way to implement these actions is once you have the first confirmed known case of community spread of a virus like this, that's when you implement these measures, because we want to make sure we keep those numbers low. And the earlier we do it, i.e. the first confirmed case, then we're taking those actions to mitigate the spread. And not see these numbers multiply exponentially, which we're likely to see some exponential multiplying, but we don't want to see it in such a case where we get the orange curve again. We don't want this, we want this, and that helps alleviate the issues that are going around. So again, take those actions and wash your hands and be cognizant of your surroundings. And I look at it this way. I look at it like, do it because you're trying to protect your parents or your grandparents. I mean, I have a 90-year-old grandmother that lives with me, so I'm very cognizant of the world around me and what's going on with this, because I know she's in one of those higher risk groups. And I'm trying to do everything I possibly can to protect and make sure I'm not worried about myself getting sick if I do, because I'm sure I can fully recover. I'm pretty healthy. But the bottom line is, I know if she were to get it, that may not be the case. So that's what I'm trying to protect against, and that's what the whole purpose of this is. And I applaud the Commissioners Court for doing what they did, because it's the right move. And I know it's difficult, and I know it's hard, and it creates anxiety for people, and it's an economic impact. And now when schools start getting canceled, I certainly understand that, you know, it's an impact, especially if they're school-age children that, you know, have to have somebody look after them during the day, and you have a parent that works. It could be a single-parent household. You know, the truth is, you know, the meal they get at school could be the only hot meal a day that these kids get. And there's ways we can work around those particular issues to try to make sure we can take care of these folks and make sure that the kids get food, especially if they're ones that only get a hot meal at school. So there's so many issues that go into this. And again, these decisions are not taken lightly. And they're very hard decisions, and they're oftentimes not popular decisions. But that's what has to be done to try to put things in perspective. And when we look back on this and you know, a few years, we're going to understand truly why the actions being taken are what being taken. So I hope you share this around. I hope the information helps. Again, if you have questions or you want to learn more, you know, you can go to cdc.gov, watch your local news, and listen to what the health experts are saying, because I think that's really important that we look to the science and listen to the leaders in the industry about what's going on, and that'll help everybody to work around these issues. And I'll do my best to keep people informed, and when I see things going on or hear things, I'll let you know. And again, I apologize for the length of this, but I think it's really important information, and I think it's important that people hear it in a tone and in a manner that says, here's some things to do. Understand you could probably get sick, and you might get sick, and it's okay because most people recover. But there's that vulnerable population that we're really trying to protect, and that's why these actions are being taken. And I don't want people to panic, and I don't want people to go buy all the supplies off the store shelves. Buy what you need for your family for a week or 2 weeks or whatever it is, and then that'll let other people be able to buy those products for their family. And it'll also allow the supply chain to be able to replenish those items on the store shelf so that people don't go and find that the shelves are just completely empty. So again, take care of each other. Look after yourself. Take those precautions. If you have questions, ask them. Call your doctor if you think that you have sickness and symptoms that may lead to that. And know that everyone is trying to look out for everybody's best interest and trying to keep this thing contained so that we can get over it and move on. And everything will come back. The stock market will come back. All those things will come back. We just have to understand that this is a point in our life in 2020 that we have to persevere and get through, and we will, and we'll do it together. And we just have to remember that we need to spread good information, factual information, and listen to certainly the experts in the field, and we'll get there. So it was good to see everybody. Again, I apologize for the length, but I think it's good information, and I'll talk to you guys soon.